I'm not trying to laugh, but
so
no, because y'all, I have the most dramatic man ever. Oh, the filter went onto your face.
Filter? Whoa.
I have a filter.
Yeah, keep it on your face.
Okay, so earlier today, Quan had an appointment scheduled to get his tooth pulled. So you guys remember, like a week and a half ago to 2 weeks, he was going through that like sinus infection or whatever it was. What we thought was a sinus infection. It ended up moving down into his jaw. He was getting tooth pain. The whole thing. Like he was getting what ended up going to your ear. Like all this whole side of his face, basically the whole left side of his face was hurting him. He got the antibiotics, nasal spray, did all that stuff, and then his tooth was still hurting him, so he went to the dentist. Dentist basically did x-rays and told him that his last molar, he had the option to either do a root canal or get it extracted. Quan decided to set an appointment to get it extracted that day because his tooth was killing him, y'all. Like, to the point.
That appointment was today.
That appointment was to be done today. So,
I still got my tooth, y'all.
Here's what you need to know.
Long story short, Quan still has his tooth, so he's here in the car fine. So yeah, basically he had the option to get the tooth pulled or get a root canal. He decided to just go with the tooth pulling. At that time though, like his tooth was really killing him, y'all. Like he couldn't deal. He had to keep taking Tylenol, extra strength to get the pain to go away, stuff like that. So in the moment he's like, yo, I want the tooth gone. So you know, we're headed to the appointment today. I'm not gonna lie, before you even headed into the appointment, he was like a little hesitant because he's like, yo, this is my tooth. Like I don't know how I feel about my whole tooth just getting like taken out.
Just thinking about it, I'm like, damn, it's just gonna be a freaking gap in a hole over here.
So he was already a little weary about it. He was like, babe, like I don't know, like I'm getting nervous. Like, I don't know how I feel about like them just taking my whole tooth out. I'm like, babe, you're gonna be alright. They said it's quick, like they're just gonna take your tooth out. Maybe down the line you could get like a tooth implant or something like that. So we get inside, we go inside to the dentist, and they call him, they're like, Shaquan Roberts. So I'm like getting up to go, like, all right, babe, let's go. They're like, oh, you can't come back. He has to go back there by himself.
They was trying to put me to sleep, y'all.
They was trying to put him to sleep.
They told me at my last appointment that I was getting local anesthesia. Yeah. When I got there, they was like, oh, we're sedating you.
Yeah, so
I'm like,
hold up.
You came with your fiance. I'm like, hold up. I didn't sign up to get put to sleep. They said good thing she's here to drive. Yeah, I'm like, what are y'all talking about? My fiance is 33 weeks pregnant. She can't carry me to the car. She can't carry me inside when we get home. Right. Like, what do y'all mean y'all putting me to sleep? I need to be able to function. Yeah. So they like, oh, let me check with the dentist and see what he says. All right, long story short, they bring me to the back. Rissa had to stay up front and wait. And
Quan didn't like that.
I did not
I thought that was a little weird though, because I'm like, personally for me, like if I'm getting sedated and going to sleep, I don't want to be in a room alone with like a doctor. Exactly. Like, you know what I'm saying? I want like one of my loved ones in there or something. That's kind of weird.
Yeah, it's exactly. If you know they put you to sleep,
like I don't know what you're doing with my body.
That you trust around.
Yeah, close.
To make sure that you good.
Or like even if you're behind the curtain or something. Yeah. You know what I'm saying? I thought that was weird. But whatever.
But yeah, they had me go back there, and I'm talking with the nurse. So I'm asking her like, why did they put me down to be sedated? And she was like, oh, most people that go through this procedure get sedated because like it's a lot that they're doing in my mouth, and pretty much
it's a big tooth.
Yeah, you'll be out of it where you won't feel any pain. I'm like, okay, if they numb me with the local anesthesia, I wouldn't feel any pain. So what's the issue? She's like, all right, no, we could do that, but the doctor's gonna need to numb you really good. So
she's like, gonna be like 4 to 5 needles.
4 to 5 needles. Warning. In my mouth. I'm like, what? All right, whatever. I could deal with the needle pain.
Yeah.
So what else? I started asking more questions. So I'm like, all right, so gonna numb me up, pull my tooth, and I'm gonna be good, right? She's like, yeah. She's well, like, I have this form that you need to fill out before we get going with the procedure.
Okay, this is the part, y'all. This is the part. You gotta listen. Okay, so you have the form on your phone, right? Yeah. I'm gonna read you guys. Basically, they wanted Quan to sign off and like put his initials down that he's giving them consent to pull a tooth, but these were like all the risks or side effects, long-term effects and stuff like that, just from him pulling this one tooth.
And
so
I was like,
when Quan started reading this, he said that his body got hot.
I'm like, oh nah, I started panicking. I ain't gonna lie. I had to call Rissa. I FaceTime Rissa like, nah, hey, read this shit. This is crazy.
All right, I'm gonna read you guys some of them.
Go ahead, read it to them.
All right, so let me read y'all some of these long-term effects or side effects, risks,
you need to know.
Well, listen, it gets worse.
Okay, so yeah, those are the first ones. Like, he's reading this, he's like, oh, hell no. Okay, nerve injury, which may occur from the surgical procedure.
You gotta keep in mind the reason why I'm getting this tooth pulled is because my nerves are acting up. My cavity is close to it. It's not even touching, it's close to it. I mean, not my cavity, my felon is close to it. This shit can cause nerve damage. Nerve damage ain't nothing to play with.
Right.
Once your nerves are uncomfortable, or if it's damaged, nerve pain is unexplainable. It's hard to explain pain.
Quan said that
it's like
when
a
he
shocking
broke.
pain.
Did you say when you broke your jaw, you had like your nerves were cut, so they had to rekindle?
I damaged my nerves in my chin because my tooth twisted, fractured my chin, and I had nerve damage down here. And when the nerves are trying to glow, see the difference is my nerves were coming back to life, like they were repairing themselves. And it was like electrocuting me. It was like a shocking type of pain. I could imagine nerve damage.
Oh, so the opposite, like it's dying.
Yeah.
Ooh, yeah, that would hurt.
No.
Yeah. Okay. So.
Not necessarily dying, like it's not working properly.
Yeah. So you're probably gonna get jolts.
So yeah, you getting like
randomly.
Yeah, shocked randomly.
Right. Yeah, that would hurt. Okay. Numbness, pain, or altered feeling in the face, cheeks, lips, chin, teeth, gums, or tongue. So you might, your whole face might start just drooping.
And I could lose my sense of
including
taste.
loss of taste. Yeah. Okay. Such conditions may resolve over time, but in some cases can be permanent. Dry socket, which is like slow healing, and this results in jaw pain that increases after surgery. So I think Quan was saying dry socket is like
Where
what they say?
dry socket is alright. Once they pull it through, it's gonna leave a hole. If I spit, because like once you have a hole down there, your body naturally forms a blood clot to fill the hole.
Warning.
The doctor was pretty much telling me I couldn't spit fully. If I were to spit, I would be spitting up the blood that's trying to form the blood clot, and it will leave a deep hole in my gums, which would put me at risk of having dry socket, which you can get an infection.
The high risk
Likelihood
infection,
of
not healing, right?
with
So
high
yeah, I don't know. That's just crazy though. Like they told him that he couldn't spit for a week if he got this one.
Really?
So you have to sit there and swallow all that.
For a week? That sounds crazy. Like, how do you not spit for a week?
So when you was brushing your teeth, you were supposed to just swallow it?
I don't know. I had so many questions. I'm like, what?
Okay.
Sound crazy.
I feel like. All right, as the list goes on, I feel like it just gets worse and worse, y'all. So let me continue reading. So it says sharp ridges or bone splinters may form where the tooth was removed, possibly requiring additional surgery.
Yeah.
So imagine you going through that and then you have to get another surgery.
Another surgery? Nope, not happening.
Yeah.
Nope.
And then it says part of the tooth or roots may be left to prevent damage to nerves or the other structures. So they saying that
Little pieces of
the tooth will be left behind,
teeth will
possibly.
be left over. No.
What? I didn't even know all this.
Crazy.
Oh no, this one sounds crazy. Wait, it says an opening may occur from the mouth into the nasal or sinus cavities. Like, what do they mean an opening?
I don't know. That sounds insane. But the whole reason for me having to get this tooth pulled was because I thought I had a sinus infection.
Exactly.
So I'm just reading all of this and I'm like, nah. I immediately changed my mind. I was like, nah.
And then
I don't
again,
wanna do this no more.
look, it says jaw fracture again. So not once but twice did they put jaw fracture.
They put emphasis on it, but y'all gotta keep in mind that's one page of 3.
Oh yeah, I was gonna say that. At the bottom it says page 1 of 3. So Quan didn't even get to page 2 and 3. He said he flipped it and saw a whole nother list.
More, I was like, nah.
He said, fuck this.
It's a wrap. Never mind.
Wait, but the last one is crazy on the first page. It says, I understand that bone grafting may be necessary. So we had looked up what bone grafting is, and basically it's like if something happens to the bone, or maybe like in the jaw or something.
They gotta take bone from another part of my body.
Yeah, to replace that bone. I was like, all right, nah, this is a lot.
Just put yourselves in my shoes. Yeah, put yourselves in my shoes and really think about all those risks that I would have to sign off for and consent to
just
before this surgery. Nah.
Just from pulling that one tooth.
For one tooth. Nah, no.
Yeah. So Quan was like, wait, hold up. So he was like, hold up. And he felt like they was like kind of rushing him a little bit to like make a decision because
they were
obviously like maybe not rushing you, but like they're like, bro, we have appointments. Come on, like put your initials down. Let's go. Let's put your tooth. Nope. And Quan's reading all. He's like, bro, this is not an easy decision. Like, relax. Let me call my fiance. Let her help me.
Help me with making this decision. So I'm like,
yeah. So first of all, when Quan calls me, his face, y'all, you look like
frantic. I don't know. I was shook. I was like, oh no.
I was
like, babe,
crying.
Read this.
He's like, hold up, babe.
Please.
I'm like, all right. So,
am I bugging?
Since they told me I couldn't go back there, I'm like, all right, babe. He's like, you were taking a while to update me too. I'm like, I text him. I'm like, babe, like, what's going on? So he FaceTimes me. He's like, babe, nah, like, they got me reading this paper.
So
he's like, I'm gonna send you this shit. You gotta read it. He's like, let me know what I should do.
That was crazy, yo.
I was like, whoa. I didn't know those were all the risks from you just pulling your tooth.
Yeah.
Like, they made it sound like it was something light. Like, he's about to go up in there and get his tooth pulled. He's Gucci. I knew it was gonna be like tender, a big ass gash in the back. Like, it's a big tooth. So
I knew that, but
obviously risk of infection, like the regular stuff. But all that other stuff, I never knew. And then Quan and I were thinking too, like, because both of us have had teeth pulled like when we were younger. I had like front teeth though, nothing back like in the molar section or nothing like that. But like,
Here's what you need to know about.
And there were probably baby tooth we got pulled. So like the grown up tooth was gonna come in, not an adult tooth being pulled. So, well, you got your wisdom tooth pulled, but that was when he got his jaw surgery. So he didn't really.
Going through pain,
yeah.
So
he couldn't tell the difference. But I was saying, like, yo, did our parents sign off on all this stuff when we got our teeth pulled? All those risks, and they just signed off on it?
That's wild. Reading that was crazy.
Oh my god. I'm like, or is that just the risk because of the molar? Like,
so
I don't know.
I decided to just schedule a root canal. I'm gonna get a root canal.
It's gonna get a root canal now.
Yeah, I'd rather just try and save the tooth without all those extra risks. If I have to end up getting the tooth pulled later on, then at least I know that I had no choice, and I decided to like go another way, another route.
Yeah, like you tried to save the tooth
to try
first.
and save the tooth before just pulling the tooth completely and having to, risk all that stuff. Things. No, I completely
understand your decision, babe.
Yeah.
Like I get it.
I don't need nobody to understand. I don't care. I don't need nobody to understand. Nobody got to rock with my decision. I can say I'm scared. I don't care. It's my tooth. It's my mouth. And I'm not about to put myself and my health at risk to impress nobody. I don't care.
Warning.
I don't care. Listen, I'm a risk taker when I feel like I'm in control.
Yeah.
But if a decision is completely out of my control, like if it's a situation where it's completely out of my control.
Afterwards, yeah.
I'm not going to sit there and go ahead with the decision. Like, I like to feel in control. So, for all those things possibly happen, nobody going to be serious.
What were you saying?
Nah, because I already know people going to be talking shit. I don't care. I don't care. Everybody talk shit until they in that predicament.
No, but your situation is different too, especially with you already having like the broken jaw and stuff. Like, I completely understand.
Yeah, I broke my jaw.
And you had a fractured chin already.
And
like,
they keep putting emphasis on a fractured jaw. Like, bro, I don't want nothing to ever happen to my jaw again.
Exactly.
Ever. Like,
yeah. And then I don't know, I just feel like since you already had that injury, like you might be more prone to it or something.
And yes, I still play football after that. That's in my control. Yes, I still boxed after that. That's in my control. It's up to me to protect myself. But if I can't protect myself, if somebody's just fucking ripping a tooth out my mouth and they being too rough and they fracturing my jaw, then I'm fucked. You know what I'm saying? So, nah.
Yeah.
Nope.
Yeah, so
not happening.
That was Quan's final decision. I need y'all to comment right here. Would you guys have made the same decision as him, or would you have just
if you got sense, you would have made the same decision.
No, but one of the reasons why Quan was initially like just gonna do the extraction too is because you guys were saying that you got root canals and a lot of you guys end up having to get the tooth removed anyhow. So he was like, all right, so I might as well just get the tooth extraction. But if he would have known all that, then he would have just done the root canal off rip. But yeah, so that's what happened, y'all.
It's crazy.
Let me know what y'all would have did right here. And don't laugh at my baby.
Don't laugh at me.